जय झूलेलाल, जय झूलेलाल ऐं सभिनी खे नमस्ते। सिंधी हेरिटेज फाउंडेशन एंड दादू जैन हांगकांग प्रेजेंट्स संस्कार। अॼु जे एपिसोड में स्पेशली फॉर यूथ स्किन ग्लो यूथ एंड पर्सनैलिटी हिन बारे में अॼु असांजे विच में क्वेश्चन आंसर थींदा। क्वेश्चन्स असांजे विच में सॼे विश्व मां टे सुहिणियूं लेडीज़ जॉइन थियूं आहिनि ऐं उन्हनि जा आंसर ॾींदी डॉक्टर बिंदु मंगानी असलकर। मां रिक्वेस्ट कंदसि श्री दयाल एन हरजाणी साहिब खे कि हू अचनि ऐं अची करे इंट्रोडक्शन सुनी। वेलकम दादा। हरिओम।
Thank you. Jai झूलेलाल and Hari Om to all the viewers all over the globe. And I hope today's program will be quite an interesting for all of you. I have the privilege of welcoming a guest of honor, Dr. Bindu Mangani Stalekar. Will you please bring her on the screen? Sorry. Bindu, a warm welcome to you.
Thank you.
Before we start, I would like to introduce you to all the viewers all over the world. Dr. Bindu Salekar is one of the most renowned clinical and aesthetic dermatologists and a trichologist. I didn't know the meaning of trichologist, so I just saw in the dictionary and it says hair and scalp expert. Correct me if I'm wrong. Dr. Bindu,
Absolutely
right?
Yes.
Okay, Dr. Bindu is a graduate in dermatology and venereology, a branch of medicine concerned with venereal diseases. She's from Bombay and she studied in UK University. She's a founder of two clinics, Skin Smart Solution, and pioneer in cosmetology, procedures like Botox, fillers, lasers, and PRP. I would like to welcome Dr. Bindu in our traditional way. Dr. Bindu, we have a tradition of sharing Kabir Sahib's Doha with the guest of honor. So if I may, I would like to present you two and the world two interesting Dohas of Kabir Sahib. And that is incidentally from my book called Kabir Speaks, just in case you don't know about it. I've written a book, Kabir Speaks, with 300 Dohas, all translated into English with a perfect English rhyme. And I would strongly recommend people to read it to get a lot of inspiration and soothing relaxation of the psyche. So it says, Sahib says, Sahib teri sahabi, sab gat raya samay, jo mehndi ke paat mein lali lakha na jaye. Now what it means, it says, the Lord dwells in each one of us, yet unseen and unknown to each one. As the red of the henna leaf appears camouflage to everyone. You got it? So our Lord of the Heart is so close to us, just like the henna leaf is green, but its redness is apparent only when applied. So just as its red color remains camouflaged, our unseen God, unseen, dwells in every being. This is one. The second dua says, Hasi kheli, hari milaye, to kaun sahe sarsan, काम क्रोध तृष्णा तजाए ताही मिले भगवान. Which means, if in laugh and play one obtains the Lord, then who is to suffer the pangs of pain? Renounce your lust, anger, and worldly desire, only then the Lord you shall gain. This is very apparent No need for me to explain you further. पर दादू ताल ठोक कर कहे, थोड़ा रोक कर भी देखो, तो थोड़ा हंस कर भी देखो. यदि रोक रोक कर करे ईश्वर को याद, माँ के जैसे गले लगाकर करे तुझे आबाद. So let us all pray to God with that feeling of smile as well as a little bit of yearning to be worthy of His grace. So now I would like to welcome all the panelists. So can you please welcome all the lovely ladies on the show so I can introduce them?
Yeah, I request Srimati Sood to join us.
Hmm.
I request
I think
Deepa Kennedy
all the speakers.
and Sheila Chugani from Manila.
So first we have Shaila Chugani from Manila. She is a bright student in fashion and business marketing at the Institute of Marconi of London in Manila. And she's aspiring to be what are you aspiring to be, Beta?
A fashion designer, probably.
Fashion designer. Okay, fantastic. Welcome. Then we have Deepa Kennedy, who had a successful career in the airlines and is now taking her expertise in new areas of nutrition and dietetics. Right, Deepa?
Yes,
Is that correct?
that's what I'm working towards.
Fantastic. Welcome to our Sanskar show.
Thank
And
you.
last but not the least, we have Samriti Sood, and she is a technology sector professional and works as a product manager for cyber security products. She has a vast experience having worked with large institutions like Nokia, Siemens, Cisco, ARM, and NASCOM. She has built and launched products for the government of India and in high-tech skilling, employment generation in the IT industry. Welcome, Sanuti Sood, and let us hope we will have an enjoyable show today. So I'll now request Shaila to first start the first question. The next will be Deepa, and the next will be Samriti. So we'll rotate all three of you with 4 questions each. Okay. Shaila, you're on with your first question. God bless.
Hi,
Go ahead.
Dr. Bindu.
Hi.
So my question is, how do you reduce hair fall?
Okay. Before I answer the question, I'd like to thank Sanskar and also Mr. Dayal Harjani for inviting me on this channel, on this show, and giving me an opportunity to give the right advice and the right help to everyone. Okay. So you asked me, how do I reduce hair fall?
Mm-hmm.
Okay. So now, first of all, hair fall has multiple causes. So we have to know what is the cause of your hair fall, like the hair fall cause in you and in, say, Mr. Dayal or anyone else will be different. So commonest causes of hair fall can be, first of all, nowadays post-COVID. It can be post any infection. It can be due to any deficiency like iron deficiency and protein deficiency, or it could be because of a thyroid imbalance. So first and foremost, it's always good to, rather than just taking any tablets or applying any lotion, it's always better to find out what are the causes in the person, in the particular person. And if cause is identified, it's very easy to eliminate. So if there is iron deficiency or any of these deficiencies, then the right medicines will be given. And an application is there. Peptides are applied on the scalp, and even minoxidil is applied on the scalp. That increases the blood supply to the roots, and that will regrow the hair. So, in short, in a nutshell, oral vitamin supplements will be given to you, and then you'll be given lotions to apply, which increases the blood supply, and that's how your hair fall will decrease.
Okay.
Next, Deepa, you're on with your next question.
Can you hear me?
Yeah, now I can hear you.
All right. So my first question to you is, how do we prevent and treat dark circles?
Okay, how do we prevent dark circles? So again,
Prevent and treat dark circles.
yeah. So first of all, so in my book of treatments, I always like to go to the cause of anything. So once you find the cause and you eliminate the cause, half the treatment is already done. So, causes of dark circle, in a nutshell, I will tell you. One is, of course, it's hereditary, it runs in families. Then, if there is any B12 deficiencies, and in some, if there is allergies, people who got allergy to dust, people who got asthma, they tend to have dark circles. And women who are anemic, who are having heavy periods, they also can have dark circles. And of course, nowadays, work from home. So you're all the time straining for at least 10 to 12 hours a day in front of the laptop. So if these are the causes, so in a person, find what is the cause, and then how do we prevent it? Give iron supplements, start taking B12 tablets, and treatments, we get creams which contain hydroquinone, which contain kojic acid, which contain arbutin. So these are the creams which can be applied at night, and always a sunscreen in the morning. Is
So
there a
these
lot of
creams-
disturbance, or am I only getting it?
Okay. Next is Samriti. Your first question.
Hi, Dr. Bindu.
Hi,
Thanks again for coming to the session.
thank you.
So my question is, how safe are the anti-aging treatments, and at what age any women should start these treatments?
Uh, I'll answer your second question first. At what age aging starts? Aging starts, you'll be surprised, at mid 20s. So by about 25, aging starts. And there is micro aging and macro aging. So at the age of 25, micro aging starts. You may start getting pigmentation, fine lines, and the collagen building decreases and the breakdown increases. So this is at the micro level. And at the macro level, you will see later on pigmentation, you will see folds coming up, you will see jowls coming up, skin sagging. So that is at the macro level. So how do we prevent it, or how do we treat it? So prevention is, I tell everyone that start applying sunscreen once you're 6 months old. Even to babies, start applying sunscreen, because sun is one of the biggest external factor which causes aging. There are other factors like genetic, it all depends, and smoking, what food you eat, your lifestyle. But one of the main factors is sun. So sunscreen is a must. So that is one way you will prevent. And of course, at home, you all can start at least applying vitamin C. Now, you all have all heard about vitamin C, which is an antioxidant, and that you can start applying in the mornings under the sunscreen. And at night, I like to add retinol containing creams. So, as we go further towards the show, I will talk more about retinol. So, start applying retinol at night and sunscreen in the morning. And now, second question, how safe are the anti aging treatments? They are very, very safe. They are very safe provided you have gone to a board certified dermatologist. And the board certified dermatologist will only do treatments, even things like Botox, fillers. Now we have lasers, we have anti aging machines, which are skin tightening machines. They are very, very safe because they have been tested. In USA, they have been tested, and test studies have been conducted since the last 10 years, 15 years. And US FDA will never give a green signal to use this on the population if they were not safe. So by and by you can ask me more details, then I can talk more in detail.
Okay, Shaila, you're next.
Hi. So my next question is, what are some causes and treatments of dark lips?
Okay, dark lips now. One of the causes is, again, everything boils down to hereditary. We inherit the good and the bad from our parents, from our grandparents, from everyone. So sometimes it runs in families, dark lips. Secondly, if at a young age we have applied lipsticks, many girls are fond of applying lipsticks. So even at a very young age, 7, 8, 9, they start applying lipsticks. So they may get an allergy to the chemicals in the lipstick. So that is a process which starts at that early age. And then of course smoking. Thirdly, sun. If you had a lot of sun exposure, so remember, lip skin is a part of your facial skin. So just like you can pigment on the lips, you can pigment on the face. So coming back, hereditary, then if you're a smoker, if you've applied any lipsticks, or if you had any drug allergy, there are some medicines which give rise to allergies. So you start getting dark lips. So these are a few of the causes. So again, if a cause can be eliminated, fine. If not, if it's hereditary, you can't do anything. But treatments are there nowadays. We are in the 21st century. So we have treatments. So what I recommend is, of course, again, apply a lip balm which has sun protection, number one. Number two, you can apply skin lightening agents we have now, which are over the counter, things containing kojic acid, arbutin, mulberry. So apply this at night. And of course, now we have treatments in the clinic. Lasers are there, very, very safe lasers, Q-switch lasers, which also help to lighten the pigmentation, and chemical peels. These are all very safe and they give good results. But remember, it takes anywhere between 8 months to 1 year minimum. So we require patience.
Okay. Thank you.
Deepa.
My next question to you, Dr. Bindu, is how do we get rid of dandruff?
How do we get rid of dandruff? Now, I want to say over here that dandruff is not something dirty. Dandruff is not something contagious. So if you see someone with dandruff, don't run 10 miles away from that person, because it's not contagious, and it's not that that person has not washed his or her hair for 5 days. No. It's just that his or her skin is multiplying rapidly. The epidermal cell turnover, that means your top skin regenerates every 28 days. Similarly, the skin on the scalp also regenerates every 28 days. But in some, it regenerates every 14 days, 10 days, very early, very quickly. So therefore, dead cells go on collecting on the scalp. Plus, there is excessive oil production. The oil glands are large. There's excessive oil production. And then there is a normal yeast which remains on our skin. But in the presence of the excessive oil glands and the dead skin, it multiplies. So people start getting itching. So itching is not because of lice. Itching is not because of infection. Itching is because of excessive yeast production on the scalp. So
Right.
treatment is, you have to tell them to wash the hair more frequently. Do not apply oil on the scalp if they have dandruff, and wash the hair with anti-dandruff shampoos which contain ketoconazole, ZPTO, and selenium sulfide. But here I would like to add one thing. In all my practice and in all my years, there are people whom I have to teach how to use a shampoo when they have dandruff. The patient will come and say, "Doc, I have used the shampoo, but my dandruff is not going away." So then I sit and ask them, "How did you use the shampoo?" So they say, "We took the shampoo, we applied it like this and put it on the scalp." Now I'm sure all the people who are watching this will realize that their skin on the palm is getting cleaner. So the trick is you have to tell the person, take the shampoo in the palm of your hand with the fingertips, apply it on your scalp. It is the scalp skin which needs the treatment. So the
Right.
shampoo contains ingredients which will calm the scalp skin. So apply the shampoo on the scalp, leave it for a few minutes, and then rub it gently and rinse it off. So that is the trick which many people don't realize.
Right. So what kind of ingredients should we look for in the shampoos that we are picking up for dandruff?
Dandruff, the shampoo containing ketoconazole, containing selenium sulfide. There are shampoos which contain cycloperoxolamine. There are shampoos which contain selenium sulfide, ZPTO. These are all available and they are all very safe. A pregnant woman should not use a shampoo containing ketoconazole
Right.
or salicylic acid, but
Right.
otherwise, for anyone, these are very safe. And remember, dandruff can be controlled, never cured. For dandruff, people who have dandruff, they have to decrease their foods like sugar, too much maida. They have to decrease that because
Right.
everything what you eat affects your body. So
Right.
they have to decrease that, and at the same time, and stress may worsen it. Sometimes winter also aggravates the dandruff. So these are a few things. And here I
Right.
will tell you one thing which all of you will like. Like you go to the kitchen, take a tomato, puree it, and apply it on your scalp. That changes the pH on the scalp, and that decreases the dandruff.
Oh, that's a brilliant tip.
Yeah, I know.
Can I
Thank
interrupt
you.
you there? What about people who don't have so much hair? What do they do for shampoo?
People who don't have hair, they do not have dandruff. But they may get other things. They may get seborrheic dermatitis of the skin, but they generally don't get dandruff. So you have a plus
No,
for
but
you.
people like me, there must be many people like me. Do we need shampoo to do? Then do we need shampoo?
You have hair at the back of your head, so you need a
Yeah,
shampoo there. But
then it's
here, if you
okay.
don't have any hair, you can use your body wash.
Okay. Okay, go ahead, Sood, Samriti. Samriti, can't hear you. We cannot hear you, Samriti.
Okay, okay, I'm back. So, Dr. Bindu, my next question is Botox, fillers, thread lifting. Can you shed some light on them and regarding how effective they are they safe?
Okay. That's a very good question, and nowadays it's on everybody's mind whether they are safe or not. Here, I'd like to tell you, let's take Botox. Botox is, all of you all know, where is it produced? It's produced from a bacteria and it is safe. It is so safe in the right hands. The key word is in the right hands. It is so safe that it is used in as young as 2-year-old kids with cerebral palsy. So if it was not safe, neurologists would not use it in a kid who's 2 years old. So that answers the question that it is safe. Number one. Number two, we are only hearing the downside of Botox, but if given correctly and given to the right person at the right time, it is a great treatment. I'll just give you one or two examples. We generally say we are giving it in the forehead lines and we are giving it to the frown lines. So it also helps to raise your eyebrows. With age, eyebrows tend to come down. So we can raise the eyebrows and give the person the same youthful look. When they are younger, the eyebrows are higher up and the eyes look brighter. That is one. Another very important treatment for Botox, I'd like to say, for hyperhidrosis. Hyperhidrosis means excessive sweating of the palms or of the underarms. I'll give you all a little, I'll take 30 seconds to tell you all a story. I had a patient who who had come to me some few years ago, and she said, and she was only about 25. She said, Doc, I sweat so much that I only have black t-shirts in my wardrobe. I cannot buy I cannot wear any other colored because instantly you see a patch of sweat. I cannot do that. So she says, I always buy same 2 colors and 3 colors, same type of t-shirts. In my office, I go and change in the afternoon. So tell me, so the treatment for that is Botox, sorry, botulinum toxin. Botox is a trade name. Botulinum toxin, if it's injected in the underarms, it decreases the sweating. So I did it for her and she was so grateful. Some other people, they sweat too much and they are always very apprehensive about shaking hands. They never shake hands with people because they are always dripping sweat. So again, the treatment is botulinum toxin. So I know we are only seeing the flip side of Botox. And one more thing I'd like to add over here, there are many people who have a gummy smile. When they smile, their gums show. So when their gums show, they get very conscious. And all I have to do is give very minute doses of Botox in the right muscle, and that gummy smile disappears. So these are all the good points of Botox. Okay, next, let me go ahead. What was your question? Botox and?
Fillers and thread lifting.
Yeah, okay. So now anti-aging, now during aging, as I told you on the macro level, the fat which we have, that we have smooth contours, they get diminished. So you see hills and valleys, fat disappears. So the skin starts to sag. You start getting nasolabial folds and people start noticing a jowl. So whenever there are hollows, fillers are nothing. They contain the same substance which is there in your skin. And that comes pre-filled, sterilized, and that you open it and just inject it wherever there is a hollow. And you lift the skin laterally so that it restores you to what you were without making you look artificial. So even thread lifts nowadays, all they do is see what happens. Some people have got big faces and a lot of fat, but still they have jowls. So for them, thread lift is very good because you just pass threads inside and just lift it. So when you lift it, these threads, they dissolve. They are threads by which we do sutures. They dissolve after 4 to 6 months. They last for about 6 months. But the threads which are put inside acts as a scaffold on which your collagen is formed, and that forms your skin. So I repeat, if done by a board certified dermatologist, if not overdone, then it gives you the treatment where people will say you're looking good. Everyone wants to look that way. And don't we color our hair nowadays? At some point, coloring hair was a taboo. But now, if you don't color your hair, you are asked, why aren't you coloring your hair?
Okay, next, Shaila.
Thank you.
Hi, so my next question is, how do you get rid of stretch marks?
Okay. Now this who gets stretch marks? You know what a stretch marks? This is the first layer of the skin, and there's a second layer of the skin which tears because
Okay.
that's not so elastic. So that tears. That tears when pregnant ladies the uterus becomes large, or when you put on too much fat, or when the young boys who are pumping a lot of iron, so they develop good muscles. They want to become Mr. Universe, so they develop good muscles. So therefore, the skin tears. Now, when the skin tears, then the treatment which we have, of course, retinol creams, that is prescription creams, tretinoin creams, they can be applied, but that results will be only seen after 2 years and 3 years. So nowadays we have very good treatments. We have lasers, we have machines called microneedling RF, and we have peels. the lasers and the microneedling RF, what they do, they go down to the second layer. They cause micro injuries to the collagen. The collagen grows and fills that gap. And in my clinic, what we do additionally, we do PRP, that is platelet-rich plasma. You must have all heard about PRP. It's good for hair regrowth, also, Dayal. So the platelet-rich plasma, we take the blood, extract growth factors, and we inject
Okay.
in the stretch marks.
I'm
So
coming.
that is healing very well. So these
Okay.
are good treatments for stretch marks.
Okay. Good.
But
Shall I
can you
use
get
it?
rid of them? Can you get rid of them with just like cream or like lotion?
Yeah, so if somebody doesn't want to do any treatments, then as I said, retinoid creams can be prescribed by a dermatologist. But remember, this is you're applying a cream. It'll penetrate. Retinol creams do penetrate. They do cause collagen building, but that will take minimum 2 years. And even these treatments which I talked about, lasers and PRP, also take anywhere between 6 months to a year. But nonetheless, we should be very hopeful that nowadays there are treatments.
Yeah.
Okay. Okay. Next, Deepa, you're next.
Yes. My next question to you is, what are the causes of dark underarms? And can it be treated? Can it be lightened? Can it be treated to make them, look lighter?
Yes, dark underarms. In fact, this is nowadays it's on the rise because dark underarms is a sign of insulin resistance, which is on
Oh,
the
wow.
rise. It is a sign of insulin resistance. I always say eyes are the window to your soul and skin is the window to your inner health. So there are
Right.
many things on the skin which we can pick up. So one of them is dark underarms, dark lines on the neck, and patients will come and say, "Doc, I hardly go out in the sun, but I get tanned very quickly." That's a clue. And they also start getting small skin tags. So these are all signs of insulin resistance, and this is a pre-diabetic condition. And nowadays, it is on the rise because of the junk food which we eat, no exercise, and when we eat all these foods which are of high glycemic index like maida, sugar, they also increase this insulin resistance in a person who's got a hereditary for diabetes. So dark underarms, dark groin, these are the signs which show up. Now, if you see this, then the first thing I do is check the insulin levels, check the all the blood tests are done, and
Right.
if the insulin level and the sugar will not be high, but the insulin levels are high, that's an indicator that this person will land up with diabetes sooner or later. And girls who have this are also prone to landing up with polycystic ovarian disease. So skin is no
Right.
longer just cosmetic. Skin is, as I said, a window. So if we do see this, insulin levels are high, then nowadays metformin is a medicine which is started early to prevent that person getting diabetes. So that is very, very important. And once this is done, medicine is started, then we have treatments. We have yellow peels, we have retinol peels, and then lightening creams, as I mentioned, hydroquinone, kojic acid, all those can be started, and lasers. This will only work when your insulin level comes down. Otherwise, it's a futile exercise. So
Right.
by just going to a beauty parlor and applying lightening creams, it's not going to help. It has
So
to
once
be A plus B.
so once the insulin levels come down, could it naturally get lightened, or the
Yes,
peels and all?
yes. Naturally, also it will lighten. It will lighten. I am seeing girls as young as 15-year-olds who are coming with this.
Right.
Yeah, so it will automatically lighten even if you don't want to apply any creams, as long as the cause is removed, the insulin level comes down,
Right.
this will lighten. Yes.
Very vital information. Thank you.
Okay, next, Sud.
Smriti, yeah. So, Dr. Bindu, my next question is acne and scars. What are their treatment options and the treatment for pigmentation?
Okay. Acne now, cause of acne in youngsters, it is because of a hormonal, the hormones are getting, what shall I say, stable. It's always the androgens, the male hormones, which cause enlarging of the oil glands. The oil glands get blocked, and if a person has got genetic tendency, they start getting acne at puberty. Now, the lucky people, the acne stops at the age of, it starts at 13, goes away by 18, 20. But there are some who continue to get acne till 20, till 30, 40, adult acne. So all these, even if you see an adult with acne, then one again the cause is coming back. In men, it could be insulin resistance. In women, also insulin resistance together with polycystic ovarian syndrome. Then, of course, if there is any hormonal imbalance, if there is a thyroid imbalance, also you can start getting acne. So just acne on the face, on the skin, cannot just be treated by anti-acne measures. Mild, yes, but if it continues for 1 year, 2 years, 3 years, you should get treatment by a dermatologist and get investigated. And sometimes, if there is a hormonal imbalance, the girls will have to be investigated for PCOS and will have to be given anti androgen medicines. Likewise, even in men who are 40 and they're still getting acne. So, if they have underlying insulin resistance, they will have to be treated. So, my point over here is that acne you should treat. Earlier, mothers would tell their kids, I can say in Sindhi, chade days, pareng hali venda, it will go away, but that is not so, because it can leave the acne sequelae, which is first of all brown spots, and secondly scars. Scars are like dents in your skin. So when there are dents in your skin, you need medical treatment with lasers and with all those treatments which have to be done in the clinic. So again, now we have lasers, we have fractional CO2 lasers, we have microneedling RF, we have subcision where you put in a needle and you break the bands, and again PRP. So these multiple treatments have to be done if there are scars. But if there is acne together with just marks, if it's mild acne, it can be treated by, say, your retinol creams, benzoyl peroxide creams, and salicylic acid face washes can be treated. But if it continues and it does not appear to go away and it recurs, a dermatologist should be seen and should be investigated. Then only the person's acne will go away. I'm trying to be
Thank
brief
you.
at the same time informative, so I don't want to bore you all with too much of
Yeah,
info.
so I'm going to interrupt you guys. Dr. Bindu, I have two pertinent questions. I've seen that women in the West have a tendency to get wrinkles or freckles or whatever much faster at the age between 40 and 50 in comparison to the females in the East. What do you think is the reason for this? Can you explain or expound?
Two things. Two things. Women in the West, we Caucasians, they have light skin. They don't have the melanocyte, the cover which we are blessed with. We
What do
have
they?
a color, and so
Yeah.
the pigment which we have, it acts as an umbrella. It does
Okay.
not allow the sun to hit your skin. It forms an umbrella.
Okay.
So that umbrella prevents the harmful rays of the sun to go deep down and damage your skin. So we
Okay.
Indians are very lucky, we are protected. Whilst the Caucasians, that is the American skin, it does not have that. So the sun goes down to the deeper layers of the skin and damages the skin. There is a lot of end products like advanced glycation end products which damage your DNA of the cells. So
Is it?
yes, they start getting too many wrinkles, too many lines, and they look much older at 40 than an Indian or a Hispanic at 40.
Exactly. So, what
Yeah.
kind of advice would you like to give them?
I would like to give them, and also Dayal, what used to happen, they get sun very scarce. There's a lot of scarcity of sun there.
Hmm.
So they have those 4 seasons. So moment it's summer, they're out in the sun at least 10 hours a day, at least earlier. They should sun themselves. But now they use a lot of sunscreens. While we get sun 365 days of the year, we do not go out in the sun. We protect ourselves from the sun, which is good. So nowadays, the West is realizing the folly of excessive sun exposure. So they definitely use a lot of sun protection. Also, up until now, we are blessed. We don't see so much of skin cancers. Malignant melanoma is relatively rare here because of our melanin. But
Hmm.
there, malignant melanoma is quite common. So
I
we
see.
are blessed.
Oh, that's great. You mentioned something about PCO. I didn't really follow that. What is that? You.
PCOS is polycystic ovarian. Now it's called a syndrome. Earlier it used to be called polycystic ovarian disease. But polycystic ovarian syndrome is girls nowadays, young girls at the age of 14, 15, they start having cyst in the ovary. And when cysts in the ovary are there, that increases the male hormone, which causes hair fall, which causes acne, which causes excessive facial and body hair. It can cause irregular periods. And nowadays, PCOS is like a lifestyle disease, like how diabetes, it affects all the systems of the body. Similarly, PCOS is known now. Studies have shown that it affects a lot of systems. It can cause, I don't want to scare everyone. This was a light talk, but PCOS, if anybody has been diagnosed, they have to be very careful
Hmm.
and they should go to they will have to see a dermatologist and an endocrinologist, and they will have to be monitored. I don't want to scare everyone. I just want to, alert them. That's it.
So, can you tell us something more about the relationship between diabetes and skin problems in a few, one or two paragraph, one paragraph or something? And
One or
what
two
kind of
lines.
advice would you give to people who have diabetes? What should they do for skincare?
See, people who have diabetes, first of all, the diabetes can be picked up by just looking at the skin. Remember, I said they tend to tan faster, even with a little sun exposure. They start getting darkness on the folds, underarms, neck folds.
Okay.
They start getting small wart like things. These are called skin tags. They start
Hmm.
getting that. So, these are the things which a diabetic generally will have. Also, they have to take care. If their skin is dry, they should moisturize the skin. And because moment they do not moisturize, if the skin is dry, it starts getting cracks, it starts getting itchy, people will itch. Moment they itch, there are chances of infection. So a diabetic cannot afford to have cuts on the skin because they are prone to infections. So they have to take care of the skin, even on the feet, because people who have diabetes, they can get a little less sensation on the soles of the feet.
Hmm.
So they have to look at their feet at the end of the day to see if there are any cuts, because if they have no sensation in the soles And if they've got cuts, they have not realized it, but cut can become a wound and can lead to a non-healing ulcer. So, in short, look after the skin, moisturize it well. Now, here I'll give you a trick. Have a shower, pat your skin dry, do not rub, and within 3 minutes, apply a moisturizing cream in the summer, and in the winter, a moisturizing ointment like petrolatum jelly. And do this every single day and examine your feet at the end of the day.
So, would you advise people with diabetes to avoid places like Bali and Phuket and have that extra sunshine, or what? Would that
Extra
affect them?
Dayal, I hope by the end of this talk, I hope people don't feel that Dr. Bindu is recommending sit in a burqa or don't go out. No. Of course, go to Bali, go to Maldives, go to Phuket, but with the right precautions and preventions. Apply a sunscreen, a broad spectrum sunscreen, 15 minutes before you step out, UVA plus UVB blocking sunscreen, reapplied every 3 hours, 9 o'clock, 12 o'clock, 3 p.m., reapplied, wear a nice big Mexican sombrero, put
Yeah.
that, and have fun. Go on the beach, go in the water, of course.
What is this mineral sunscreen? What does that
Yes,
mean?
yes. And your sunscreen has to be waterproof, water resistant. Yes, now that was a good topic you said. Nowadays, new studies are showing that mineral sunscreens are better. They contain zinc oxide, and zinc oxide is a physical block which reflects the sun rays. So that is better. And nowadays, chemical sunscreens which contain oxybenzone are real. It's coming into disrepute because it is seen that when you go into the water, they form hydrogen peroxide is released that is bleaching the corals, the coral reef. So nowadays, mineral sunscreen is the best, containing zinc oxide, so that is reflects the rays. And nowadays, I would like to add over here, people who work from home and are in front of the laptops about 10 hours a day, the digital devices emit blue light, and that blue light causes a lot of pigmentation and blotchiness. So you must use mineral sunscreens together with iron oxide. Iron oxide is the only chemical which will protect your skin from blue light. So pick up sunscreens which are mineral, which contain zinc oxide, and if they have iron oxide, that's ideal. And you do it the way I've told you, you'll have no problems.
Any particular brand you recommend?
Brands, you have Heliocare is good, Avene is good. Girls try and use tinted sunscreens, because tinted sunscreens do have iron oxide, and they do have, and mineral sunscreens.
Okay. I'll
So
let Shaila ask her last question. Shaila, you have your last question?
Yeah. So I wanted to ask, I wanted to ask if there's a different impact on our skin for vegetarians and non-vegetarians.
that's a very tricky question you're asking me, and you're putting me on the fence because I'm a vegetarian. So see, non-vegetarians, everything in moderation is good, whether you're a non-veg or whether you're a veg. But non-vegetarian, what happens is that if the protein intake becomes a lot, people don't realize how much our body is equipped to handle proteins 1 gram per kilo body weight. Okay, so if you're having a normal diet with your chicken, with your eggs, but there are some nowadays who go over the top. There are boys, men, from the age of say 18 onwards, they want to build muscle, so they start having high protein diet because they want to build muscle. So they not only up there, they have 12 eggs, they'll have chicken, they'll have one whole chicken, plus they have protein powders. So the intake of proteins will become more than 1 gram per kilo body weight, which is fine. Even if it goes up to 1.2, 1.5, as long as they are burning it. But if the protein becomes too much, that causes an increase in the androgen levels, that is the testosterone, which leads to hair fall, which leads to acne. And this is in men. And in women, of course, then they start getting other problems also. But over here, a word of caution, the kidneys, as long as you're burning that excess protein from your non-veg, it's fine. But if you're not able to burn that much, it's an overload on the kidneys. So you have to be careful. With a veg diet and a non-veg diet, there is no difference, provided it is in moderation. Everything in moderation is good.
Okay, thank
Okay.
you.
Your last question, Deepa?
Yes, you briefly touched upon it. Maybe you can elaborate on role of vitamin C serum on the face.
Okay, so now here I'm sure all the ladies would want to know your skincare routine. I mean, when patients come to me, they all ask me, what should my skincare routine be? So when I say, let's talk of people 25 onwards, okay? So skincare routine, first of all, I'm going to be very, very brief. First of all, find out what's your skin type. Your skin type is as individual as your blood group, mostly. So find out your skin type. Wash your face at night with a soapless cleanser. Do not apply anything. Wake up in the morning and wash your face again. And after 2 hours, take a tissue, dab it on the face for about 30 seconds. If you see oil blotches only on the T zone and nothing on the C zone, that means you have a combination skin. If you have very little oil blotches all over, if it's very little, it's normal skin. If it's a lot of oil, you have oily skin. If no oil blotches at all, you have dry skin. So now, when first know your skin type, then you go to your skincare routine. Now, earlier it used to be cleansing, toning, moisturizing. I tell my patients, cut off the toning. Toning was when we were using soaps, and toners used to only remove the residue of the soap left behind. But nowadays we are using sophisticated face washes which don't leave any residue. So use a face wash pertaining to your skin type. You can apply a vitamin C serum. Now, the order of application should be thinner to thicker. So, after cleansing, use your treatment, that is your vitamin C serum. If you are in Hong Kong and in winter, then it's cold. So after the serum, wait for 10 minutes, 5 minutes, and then apply a moisturizing lotion, followed by sunscreen. Or you can apply your makeup if it's opaque. This is your morning routine. CTM, I say cleansing, treatment, moisturizing, sunscreen. And at night, it can be cleansing followed by treatment with retinol serum. That is at night, but that you can use it 2 or 3 times a week only initially, and then that's it. If it's winter and your skin feels cold, you can moisturize it. So this is your routine. It should be, suppose now someone who is say 45 and doesn't want to use vitamin C, or in sometimes they can use serums containing vitamin E. They can use serums containing hyaluronic acid, which is a moisturizer. But that would be your CTM, cleansing, treatment, moisturizing. So it all depends on your age. But vitamin C serum ideally should be used in the morning because it's an antioxidant. It mops up all your free radicals and which are produced in the morning when you're in front of the sun.
Right. Thank you.
Okay, Samriti, your last question before I end the show with some questions.
So,
Please go
Dr.
ahead.
Bindu, you shared, yeah. So my question is, we actually touched upon this, the dark circles, right? So what would you recommend in terms of treatment? We did briefly touch upon it, but what would you advise us?
Yeah, so for dark circles, I always say identify the cause. If there is iron deficiency and there is B12 deficiency, anything, then that has to be corrected. Iron has to be given, B12 has to be given. Apply lightening creams, vitamin C creams, eye creams which contain vitamin C. And sometimes what happens is that if there is a lot of pigmentation, then lightening creams have to be applied. And nowadays, and of course, the sunscreen in the morning. And nowadays, another thing which I have seen it works great is we have skin boosters. It's a moisturizer which is injected. So I inject very micro doses under the eyes. People who have dry lips, I also inject in the lips. So the lips become hydrated. There are many people who have dry lips. So under the eyes, when they have dark circles, and many people who have allergies, they sit and scratch because that area is dry. So these skin boosters are injected very carefully, just micro doses under the eye, and that gives very, very good results. And there are some Indian girls have a lot of darkness perioral region. So there also I inject skin boosters, very, very, very low doses, and that helps to lighten. So this is in addition to the lightening creams and to the sunscreen, which can be used under the eyes.
Very good. Okay, thank you, lovely ladies. Thank you, Samriti. Thank you, Deepa and Shaila. Most welcome, and thank you for your lovely presence. Now, I'll ask last two questions before we end the show. What does the skin glow have to do with one's psyche or soul? You were mentioning casually over there, but we didn't discuss this thoroughly. So, can you tell our viewers your opinion about this relationship between your soul and the skin?
Eyes are the window to your soul, skin is the window to your inner health. And we know, and skin is the part which is visible first when we see the person. And if we see a glowing skin, we automatically think that this person is healthy and youthful. Am I right or wrong? It's automatically when you see someone with a glowing skin, we know that the person is healthy. So that, and also my mantra in life for my patients is eat right, think right, treat your skin right. So if you eat right, as I said, avoid things like maida and foods with high glycemic index like sugar, and nowadays even dairy, too much dairy if you avoid. So eat right, think right. Think right is when we all have stresses. We all have stress. We are living in a social world. We interact with people. So we have 8 hours of stressful time in offices, and it is again scientifically proven that after the 8 hours of cortisol which is produced, adrenaline which is produced in your body, you go home and 30 minutes of think right, that is either meditation or you do exercise is a stress buster. So I tell my patients, either you meditate, girls who want to join a dance class. There are some people I say you go to a gym and hit that punching bag. As long as you have an outlet of your stress for 30 minutes, it is scientifically proven that it washes away all your stressful hormones. So eat right, think right, and treat your skin right by applying sunscreen and the right anti-aging treatment on your skin. So
What about
if your skin glows, you
yeah?
automatically will be happy.
What about sweating? What is the relationship between sweating and skin pores? they say that you should sweat a lot or sweat normally, regularly.
See, sweat is your body's way of throwing out toxins.
Right.
So there are some people who sweat a lot and there are some people who sweat minimal. So it's not that people who sweat minimal are unhealthy. No.
Hmm.
It
I
is
see.
their way. You don't have to sweat buckets to throw out all the toxins. No. You are throwing out excess water which should be held within. You need hydration. You need hydration. Your skin will only glow if it's hot, if it is hydrated. I always tell my patients a difference between a raisin and a kismis. Kismis is everyone knows what is kismis. A raisin, sorry, and a grape.
Hmm.
Grape, the skin is so luscious, while a raisin, the skin is so dull. The only
Correct.
difference is water. You
Hmm.
take the raisin, soak it in water, it'll become like a grape. So
Correct.
similarly, you sweat buckets
Hmm.
excessively. You're only dehydrating yourself.
Okay.
So it's not that it's healthy to sweat buckets or sweat lots. Your body knows how much to sweat, how much to throw out water. That is why in Hong Kong, in Bombay, where the humidity level is high, we do feel thirsty.
Okay.
But if you go,
My
if
last
you go
question
to any, yeah, okay, go
before
ahead.
we end the show. What would you have any idea as to what percentage of the skin symptoms or problems are psychosomatic? Would you have
Now,
any knowledge on that or percentage? Some kind
um,
of indication? Because I believe that most of the diseases are psychosomatic. So skin eruptions, acne, all these skin problems are a direct relation to your the way you think and the way you express your emotions or you suppress your emotion. So which reflects in the skin problems. What do you have to say for that?
it is absolutely right, Dayal. You are 100% right. I am almost a counselor to my patients because I believe most of the skin diseases are stress related. Most of it. Okay.
Hmm.
Most of it. And it is nowadays more and more skin diseases are getting scientifically proven. So I 100% agree with you that most of skin diseases are psychosomatic. There are a few, I would say, fungal infection.
Okay,
It's
thank
not.
you so much.
But still, most of it because stress reduces your immunity and you get susceptible to problems. So I agree with you.
Thank you so much. It was really a very interesting show and really a great pleasure to have you with us. And I'm sure all our viewers and all our panel speakers have really enjoyed communicating with you. And with this, I will request now, I think it's time for us to conclude, right, Narayan? So I will conclude the show now. And once again, thank you so much, all of you, right? Bindu, thank you and hope to see you in Bombay
Thank
in
you
April.
very much. And if anyone wants to communicate with me directly, you can share my email address or you can share my
Yeah,
number. I
sure.
have no problems. Yeah.
Definitely, they'll all come to you.
Always ready to help.
Yeah, with a special treatment for Sanskar family members.
Thank you.
Thank
Thank
you.
you.
Take care. Hari Om.
Thank you.
Okay,
Bye.
girls.
Hari
Thank
Om.
you.
Hari Om.
Okay, Naranji.
हाँ जी,
Hari Om.
हरिओम हरिओम। अॼु मार्च जी 14 तारीख़ ऐं हाणे असांजो पंहिंजो त्योहार अची रहियो आहे जाम जल्दी, चेटीचंड। हिन दफ़े मां सॼी सिंधी संगत खे अपील कंदुसि कि हिन दफ़े चेटीचंड धाम धूम सां सॼे विश्व में मल्हायो वञे ऐं हिन दफ़े ऑफलाइन प्रोग्राम कया वञनि। ऑनलाइन त 2 साल जाम प्रोग्राम ॾिठा, पर हींअर रिक्वेस्ट कंदासीं असां सभिनीनि पानीकारनि खे, सभिनी संस्थाउनि खे, सभिनीनि ऑर्गेनाइजेशन खे कि हिन दफ़े प्रोग्राम पंहिंजे पंहिंजे शहर में, पंहिंजे पंहिंजे गलीअ में, पंहिंजे पंहिंजे घर में चेटीचंड 2 अप्रैल जो केरु मल्हाए, केरु 3 अप्रैल थो मल्हाए, कोई बि ॾींहुं मल्हायो, पर सिंधियत खे, भॻवान झूलेलाल खे यादि कयो ऐं धाम धूम सां चेटीचंड मल्हायो। पंहिंजे घर में झूलेलाल जी जोत ज़रूरु सभु ॼणा ॿारियो ऐं हुन सां गॾु झूलण जी जेका सिख्या आहे उनखे बि ज़रूरु सभु ॼणा मञो। त सभिनीनि खे रिक्वेस्ट आहे, सॼे विश्व जे सिंधियुनि खे हिन फेसबुक जे माध्यम सां, कि हिन दफ़े चेटीचंड हर शहर में, हर विश्व जे हर देश में धाम धूम सां मल्हायो वञे ऐं असांजा जेके आर्टिस्ट लास्ट 2 सालनि खां घर वेठा हुआ, त हुननि खे प्रोग्राम ॾिना वञनि, त हुननि खे बि हिकिड़ो बूस्ट मिलंदो ऐं हिन सां सिंधियत वधंदी। हिन सां गॾु ई अॼु जो ही संस्कार जो स्पेशल एपिसोड ऑन स्किन ग्लो यूथ कम्युनिटी असां पूरो था कयूं। मां थैंक्स चवंदुसि डॉक्टर बिंदु मंगानी, असांजे विच में आयल स्मृति सूद, दीपा कैनेडी, शीला छुगाणी ऐं सभिनीनि खां वधीक दादा दयाल ऐं हरजाणी साहिब जो, जेके हर दफ़े नओं सब्जेक्ट खणी था अचनि पब्लिक जी भलाई जे लाइ, पब्लिक जे नॉलेज जे लाइ। ऐं ही संस्कार प्रोग्राम अॼु जो असां पूरो कंदासीं त हिकु नंढी प्रार्थना सां गॾु। हे भॻवान, असां सभिनीनि खे सुबुद्धि ॾियो, शक्ति ॾियो, निरुक्ता ॾियो, पंहिंजो पंहिंजो कर्तव्य पालन करे सदा सुखी रहूं। हे भॻवान, असां सभिनीनि खे सुबुद्धि ॾियो, शक्ति ॾियो, निरुक्ता ॾियो, पंहिंजो पंहिंजो कर्तव्य पालन करे सदा सुखी रहूं। हिन सां गॾु ई अॼु जो ही एपिसोड असां पूरो था कयूं। जय झूलेलाल, जय झूलेलाल, सदाई गॾु।